Hello there, welcome back to my channel. It's your everyday nurse Abby. So we are continuing our discussion on depression. So today we want to know about the treatment for depression. We want to find out if depression can actually be treated. Please don't forget to visit the previous video to know more about how normal sadness is different from depression. Please don't forget to subscribe to my channel, like, and also share. So let's get into our discussion for today. So depression is among of the most treatable mental disorders that we have. When we take all the mental disorders that we have, depression is one of those mental conditions that can be treated. So studies have shown that between 80 to 90% of people with depression respond well to treatment. So if you have depression, there is no cause to worry. You can't be treated effectively. So the first thing that is done is thorough examination. Thorough examination. So an examination is done to rule out the fact that the depression is not due to a medical condition. Yes, we have certain medical conditions that mimic or present with the symptoms of depression. So an examination is done to rule out the fact that your depression is as a result of a medical condition. Some of these medical conditions are we have thyroid problems, we have vitamin D deficiency. Yes, they can mimic the symptoms of depression. The examination is also to find out whether you are suffering from depression or it could be a normal sadness, not depression. So all that is done and it includes lab examination or lab investigations. So we also have psychotherapy. Yes, like the name suggests, psychological therapy. So these therapies are to help work on your mind, to help you to better understand your condition and how you can manage it effectively. So some of these therapies are we have individual therapy. So this is to help you understand the condition that you are going through and how you can bring your input so that it will help in effective recovery. We also have family therapy. So this is to bring your family on board. We teach them more about the condition and how they can help you, support you to overcome the depression. We also have insight therapy, like the name suggests. Insight therapy is to help you gain more insight into your condition. Like we say, knowledge is power. So when you have more knowledge into your condition, it can help you better understand it and then understand the treatment that you are going through so that you can recover completely. We also have cognitive behavioral therapy. So cognitive behavioral therapy helps you to recognize negative thoughts and feelings or triggers that bring about your condition, that is depression, and how you can positively respond to those thoughts or those feelings, and how you can also identify certain triggers so that you can work on them effectively. We also have we also have counseling sections that we will engage you through, which will help you also help modify your emotions so that your emotions do not overcome you. The next thing to talk about is prescribed medications. So we have antidepressants that we give to clients. These medications are given to modify brain chemistry, to bring the chemicals in the brain to balance. So in our previous discussion, we learned that there are chemical imbalances in the brain that brings about depression. So these medications are supposed to work on those chemical imbalances to bring about the balance so that your mood can be made more better. The last thing to talk about is electroconvulsive therapy. So this therapy is the last resort or the last treatment for depression, that is major depression or severe depression. When all treatment fails, medication and other therapies, when it all fails, the last resort is electroconvulsive therapy. So it we use electrical impulses to work on the brain so that it will correct the problem that is in the brain to bring about normal mood changes so that it doesn't affect you greatly. So these are a few of the treatment that you go through when being treated for depression.